Okay, let's dive into something that happens to a ton of guys during puberty, but can feel, a little awkward to talk about. It's a physical change that's super common, and we're going to break down exactly what it is, why it happens, and why it's almost always nothing to worry about. Let's get right into it.
So maybe you've noticed something new, a little lump or maybe some puffiness right in your chest area, and maybe it's even a bit sore when you touch it. It's totally the kind of thing that would make you stop and think, what's going on here?
Look, the very first thing to get straight is that you're not alone, not even close. This is a completely normal, super common part of growing up for so many guys. You're definitely not the only one going through this.
Yeah, this thing actually has a big, fancy medical name, adolescent gynecomastia. I know, it's a mouthful. But really all it means is temporary breast tissue development in boys, usually popping up somewhere between the ages of 10 and 16. It's so common it gets its own official name.
So that brings us to the biggest question of all, right? Why? Why does this even happen? Well, the answer is all wrapped up in that wild ride we call the puberty hormone roller coaster. At its core, it's really simple. It's just a temporary hormone imbalance. Think about it. Puberty is when your body's whole chemical system is getting a massive upgrade. And sometimes things just get a little out of whack for a bit. It's not a bug, it's a feature of the process.
Okay, so let's get into the mechanics. Your body, believe it or not, makes both testosterone, the main male hormone, and a tiny bit of estrogen, the main female hormone. During the, let's call it chaos of puberty, those levels can bounce all over the place. And for a little while, your estrogen level might just spike a bit higher than your testosterone. That slight temporary imbalance is what gives the breast tissue a little nudge.
So what does this usually feel like? Well, it's typically a small, kind of firm lump right behind the nipple. It might look a little puffy and feel a bit sore if you press on it. And here's a really key thing to know. It can show up on just one side or on both. It doesn't have to be even at all. That's completely normal.
All right, so I know what you might be thinking. Wait a second. Breast tissue, isn't that part of puberty for girls? And that's a great question. So let's talk about the key difference here, because this is probably the most important part to really get. This is the absolute core of it. That initial physical feeling, the small lump, the soreness, it can feel pretty much the same for boys and girls. But the biological reason behind it, and more importantly where it all ends up, well, those are two totally different stories.
This chart really lays it all out perfectly. Just look at the differences. For boys, the reason is just a temporary hormonal blip. For girls, it's a programmed developmental stage. And that difference leads us to the most important line at the bottom, the outcome. For guys, it's a temporary stimulation that then just goes away. It almost always resolves by itself. For girls, it's a continuous process that leads to a permanent, mature change. Totally different paths.
All right, so now that we know what this is and why it's happening, let's get practical. What should you expect, and is there anything you should be doing about it?
This timeline should be super reassuring. It basically shows that this is just a phase. It's got a clear beginning, middle, and end. It shows up during puberty, hangs around for a little while, could be a few months, could be up to a year or two, and then it just fades away as your hormones find their new balance.
So what's the game plan while you're waiting for it to go away? Honestly, the best thing to do is just let your body do its thing. These steps are all about comfort, really. Try not to poke or press on it a lot, because that can just make it more sore. If it's sensitive, maybe wear some looser shirts. Other than that, just keep living a healthy life. That's the best support you can give your body right now. Now, while this is almost always just a normal part of growing up, there are a few very specific and, I should say rare, signs that mean it's probably a good idea to go check in with a doctor, just to be safe. Okay, so 99% of the time, what we've been talking about is all there is to it. But it's always smart to know the exceptions. So if you see any of these things, like it's getting really large, or it's been more than 2 years and it's not getting any better, or if you have severe pain, not just soreness, or any kind of discharge, those are the times to talk to a doctor. Again, this stuff is really uncommon, but it's always better to be informed.
So if you remember just one thing from all of this, let it be this right here. This experience is normal, it's common, and it's temporary. That's it. It's just one of the many signs that your body is working hard and changing into its adult form.
At the end of the day, understanding what's going on with your own body is a superpower. It replaces worry with knowledge. And hopefully, this helped do exactly that. So what other questions are on your mind? Let us know and maybe we'll tackle them next. Thanks for watching.